Today we are going to be going over walker education. Walkers facilitate improved stability in patients with lower extremity weakness or poor balance and mobility by increasing the patient's base of support and supporting the patient's weight. However, walkers can be difficult to maneuver and can result in poor back posture and reduced arm swing. Patients that could benefit from walkers include those with generalized weakness, extremely limited ability to bear weight on lower extremities, and very poor balance. Some indications for walkers are they are typically indicated for patients who require maximum stability and support from an ambulation aid. Like other ambulation aids, walkers can help users feel safe and confident, which may lead to increased activity and independence, and the maintenance of a walker may also allow users to maintain their occupational skills. Contraindications for walkers are they result in slower walking speed, abnormal gait pattern, bulkiness. Sometimes they're difficult to store and transport. They're difficult to use with stairs and steps. There's awkwardness in narrow passages or crowds. May induce poor posture. There are 3 types of walkers that we are going to talk about today. One is the standard walker. A standard walker is the most stable walker, but it results in a slower gait, because the patient must completely lift the walker off the ground with each step. Front-wheeled walkers, which is the walker I have with me today. A front-wheeled walker, also called a two-wheeled walker, is less stable than a standard walker, but maintains more normal gait pattern and is better for those who are unable to lift a standard walker. The next walker I'm going to talk about is a four-wheeled walker. A four-wheeled walker is commonly called a rollator. It is useful for higher functioning patients who do not need the walker to bear weight. Although the four-wheeled walker is easier to propel, it is not appropriate for patients with significant balance problems or cognitive impairment, because they can roll forward unexpectedly and result in a fall. All walkers basically have about the same parts, these being the handlebars, and then this one does not have brakes, but on the four-wheeled walker there's usually brakes around the handlebars. These are the buttons that you move to fold it in and out. These are the front legs and the front wheels, and back legs and back walker tips. These little buttons down here are the adjustable buttons, which help lower and make the walker taller. So next we are going to be fitting a walker. When fitting a walker, a patient should be measured while standing, and I'm going to go over here. For a starting point, the hand grip of a walker should sit at the wrist crease as the patient stands erect with their hands down at the side. So let's turn to the side really quick so you can see. So you're going to put the walker in front, and then put your hands flat down at your side. And since her wrist is right at, the crease of her wrist is right there at the handle, it's a good fit for her. Next, we're going to go over how to sit to stand. So if you would mind sitting down. When you want to go from sitting to standing with a walker, you want to place the walker in front of you with the open side facing you. And then you want to make sure all 4 tips or wheels are on the ground. You want to scoot to the edge of your chair first, okay? And then you want to place your hands on the armrests, kind of pushing like that, right around there. And then what you want to do first is push up and then lean forward. And then just remember, you want to make sure your nose are over your toes. And then you want to move one hand at a time to the handles of the walker. Good job. And then going from standing to sitting is basically the same thing. You just want to place one hand on the armrest of the chair, and then start to lower yourself, and then grab the other hand, and there you go. To walk with your walker, you want to make sure your walker is a few inches or arm's length in front of you. Okay. You want to make sure all 4 tips or wheels are touching the ground. What you want to do first is step forward with your weaker leg, push the walker ahead of you, and then step forward with your other leg, placing it in front of your weaker leg. Repeat steps 1 through 4, and to keep moving forward, make sure you go slow and walk with good posture.